Yeah, and I think a lot of people don't make that connection between chemically how similar a lot of those serious painkillers are to the drugs you hear about on the street, like heroin, for example.
Well, that's right. And in fact, heroin used to be prescribed in Australia until the late 1950s. So it was actually a medical drug itself. And the impact on the body of an opioid, whether it's illegal or pharmaceutical and legal, is very much the same. And so we've got to improve community understanding about overdose risk, uh, and also how to recognise an overdose and how to respond in an emergency situation. And that kind of community understanding is inadequate at the moment. So we need to really boost community capacity, I think, to understand these issues. And that includes people talking to their doctors with absolute frankness and honesty about these issues. Most people that are on benzodiazepines or medical opioids are not at risk, especially if they're following doctor's advice. But it's when you sort of edge away from the doctor and think, oh, I should just have a couple more because I'm still not feeling right, that's when you can really get into trouble. The better thing to do is to go back to your doctor and discuss the issue.
John, a lot of our viewers might have also caught one of the two major dramas out at the moment, these TV series that are looking at the opioid crisis in the US. They're both really focusing on the story of Oxy, as it's known, and how that really proliferated throughout the US in a very damaging and fast way. In particular, I think a lot of people would be shocked, and I saw one of these programs last week. So the travesty, really, of the peddling of these painkillers by the medical profession. And in this case, in the US, doctors are being incentivised to essentially up their prescriptions of certain drugs for financial perks, and that's all gone through the legal process now in the United States. Here in Australia, can you reassure us that that sort of thing doesn't happen here in Australia? And what is the landscape in terms of prescribed opioid addiction now?
Well, the American lesson to us, I mean, I'd really recommend people watch those programs because they are eye-opening and they're very disturbing. The fact is, we've got an opportunity to learn from American mistakes and not repeat them here, and we've done that to some extent. So doctors have become much more conscious of the risk of prescribing opioids especially, but also benzodiazepines, since they saw what was going on in the USA, and it was really out of control. And there's a lot of responsibility to share in the United States for these issues, including the failure of the regulatory bodies. We've got a much tighter system in Australia, but we're still in the process of, I think, getting on top of this issue. So we don't have a comprehensive approach to overdose prevention in Australia. We don't have enough access for people in pain to pain care clinics, etc. So there's a lot of things that we should be doing in Australia to avoid the debacle that they've experienced in America. And, one of the things that we did in Australia, copying the Americans, was to introduce real-time prescription monitoring. And it's not clear how that's working in Australia. There's anecdotal reports that people are getting pushed out of healthcare and left to their own devices, which is highly problematic. That's certainly been an issue in the US, and that's part of the drive towards fentanyl in the US, which is people had been relying on access to medical opioids, and when that was cut off, they flipped to the illicit market. I think that is a disastrous transition, and so we need to be much more careful, I think, in Australia about treating the mental health background needs of patients, but also making sure that we don't just dump them out in the cold because we've got an increased understanding of the risk of some of these drugs, and especially their risk in combination.
Yeah, no doubt. It's a very complex issue. John Ryan, I appreciate you taking the time to help us navigate through it. Thanks so much.
Thank you.